Hi everyone, good evening. My name is Dr. Ashwin Alva. I am a proctology surgeon and a gastrosurgeon. So today we are going to discuss in brief about a very common condition, anorectal condition, that is piles. In medical term we call it as hemorrhoids. So what is piles? Piles is nothing but basically the anal cushions, they get enlarged, the veins in the anal region they get engorged and they protrude out of the rectum like masses which can be felt while passing stool, and the main symptom which the patients present with, it is bleeding per rectally, and sometimes if it is grade 3 or grade 4 piles, then the patient complains of mass protruding per rectum which they can feel. Now coming to the main reasons or causes for piles. So basically it is the bowel habit of a person. So if a person is chronically constipated, he doesn't have a regular bowel habit, he passes hard stools every now and then. This causes the friction in the area of the anal cushions, which cause the veins in the anal region to engorge and they protrude like a pile masses. Now the sedentary lifestyle in today's era and the diet which has very low fiber content, more of non-vegetarian diet which is red meat, and less of water consumption. So all these factors contribute to piles. Now coming to the treatment options. So there are variety of treatment options starting from non-surgical modalities, like we have just giving medicines if it is only grade 1 pile, and if it is grade 1, grade 2, then we can do what is called as an injection sclerotherapy or a rubber band application which is done on an outpatient basis. And if it is grade 3 and beyond, so grade 3, grade 4. Grade 4 piles is nothing but the piles has come out of the anus but it's not going inside. So for these grades we need surgical treatment, and the surgical treatment conventionally has been an open hemorrhoidectomy. But the problem, the disadvantages with this procedure is that it is very painful. There will be a big scar, incision there, and patient has to be in the hospital for around 2 to 3 days. So compare it to the conventional procedure. Now we do what is called as a laser surgery for piles. So here we use the laser energy basically to ablate the pile mass. Okay, the advantage being it is a cool laser. So the advantages are that it's a relatively very painless procedure, and hospital duration, stay duration is very less, maybe 1 day, or sometimes you can do it on a daycare basis. And then even the cost also, compared to the open surgery, it is cost effective. It is only marginally expensive than the conventional technique. So it's a painless and a scarless procedure, so which is very comfortable for the patient, so that they get recovered early and they can go back to the duty as soon as possible. For more details, please comment below. Our team will contact you. Thank you.